So look, thanks Kate and Tony for coming to this. They've just finished doing the first formative OSCE, and the aim of this is really just to get some ideas to some of the things that students did well, some of the things that students did poorly, to provide advice for students who are going to sit the summative OSCE later on this year. So I'm sure it was an exhausting ordeal today. Would you like to tell me some of the things that students did well?
Yeah, so students introduced themselves really well, generally speaking, as they came into the room, which is important to the patient and to the confederate if there is one. And a lot of people started out on the structured approach quite well in the beginning.
Yeah.
I think those are the main things.
Okay. Anything else?
Look, I think the communication with the nurse, the simulated nurse that was there, was quite good. For across the board, students did interact well. Took a little bit of time to warm up, but once they were in with the simulation, they seemed to communicate well with the nurse. So that was good. Nice to see.
Right. Okay. So were there any things that were done badly by the students that maybe other students could learn from?
Yeah, I think there are a couple of things I would highlight. Firstly, PPE. If there's PPE in the room, then there's a mark for it. So it's worth saying that you would put on the PPE or putting it on if it's there. And secondly, going through that A to E structured approach outside the room, writing on your notebook, doing whatever you have to do so that inside you've got a structure to fall back on is really important. And when you're not sure what to do, go back through your A to E again. If you're pausing, if your mind goes blank, go back through your A to E again. And we really want to use that structure where we find something wrong, we immediately fix it before moving on to the next letter. So A, seek and treat, B, seek and treat, C, treat and treat, D, E, back to A, whenever anything changes or you're not sure.
Great. And that was generally done badly or well?
Quite a spectrum.
Okay. Okay. Great.
Yeah.
Thanks.
I agree with that. And in more specifically, the case was a combined respiratory and cardiovascular pathology, trauma pathology. And I noticed that there were a substantial number of students that wouldn't examine the chest. Now that might be a simulation artifact, but the patient had chest trauma, and there were lots of students who didn't expose or examine the chest properly, and because of that, they failed to get to the diagnosis.
Yeah.
Or they noticed that there was a problem but didn't start managing the problem, so didn't put oxygen on the patient when they needed it, etc. So I think it's part of that A to E approach and having a structure and managing things as you go. And there were a few other things that could have been done better with the circulation support in terms of the management of shock with fluids and blood, and a few other finer things that that can happen that might help the patient with hemorrhagic shock.
Fantastic. Okay.
Yeah.
So we've kind of talked about the station that you've just examined in, but are there any more sort of generic advice you'd give? You're both experienced examiners in the OSCEs. More generic advice around at the emergency medicine stations, maybe?
So what I always tell people is use your time outside to work out the system you're going to use when you're inside. So write down your A to E, write down your rates for breathing assessment so that it jogs your memory when you're in there and your mind goes blank. But also get really good between now and your OSCE at formulating a differential diagnosis and then ordering that, prioritizing it, and then organizing your examination and your history and your investigations based on that differential.
Perfect. The reading time is not just for reading, it's about strategizing for
Right.
how you're going to tackle the station. Yep, good advice.
And I think it is an OSCE. So OSCEs is a skills assessment. So we don't want people just talking and say, I would do this and I would do this. We want you to demonstrate those skills because that's the whole point of an OSCE. If we wanted you to just talk about it, it would be a viable or written exam. So remember that the OSCE is a skills exam. And part of it is communication with the people in the room, either the patient or for us, it was a simulated nurse. It was well done, but I think you really need to direct your attention to that person because they are part of the scenario and they will score you.
Yeah.
Yeah.
Okay. Can you think of any sort of critical errors that students may have made over the years that have kind of forced you to fail them? I guess the thing that comes to my mind immediately would be drug doses or something like that.
Yes, I think a general really good piece of advice is don't guess drug doses. If you don't know it, say I will look it up, because we get very scared when people start guessing doses in an exam situation.
If I get it wrong, yeah.
And on the other hand, for this particular scenario, there were potentially safety errors or critical errors that wouldn't have failed the student, but would have been a big signal to me that they weren't safe in terms of how they resuscitated the patient or lacked the drive or the speed or the ability to resuscitate the patient properly.
Okay.
In terms of fluid resuscitating, which has always been a bit of a problem for students to get their heads around.
Okay, great, fantastic. Thanks for your time, and I hope you have a good weekend. Okay.
Yeah.